Okay, all right. So She Works is kind of a play on our title, and it's a multimodal, community-based participatory approach to reducing substance abuse and sexual risk behaviors among young African American women. Okay, so what is She? Format is a little bit off, but it's a program really designed to tackle alcohol abuse on campus, marijuana use specifically. We considered other substances, but we did a needs assessment, in fact, and we wanted to target the ones that the women that we were talking to were struggling with. We also had a mandate to target HIV prevention and hepatitis C prevention. And then extending beyond that mandate, we wanted to just look at general sexual risk behaviors, because I'm a big proponent of the idea that sexual risk is not just physical risk. It's not just, oh, you might contract an illness. It also can be emotional risk. It can have a lot of lifestyle changes, and so we wanted to address this from this broadest perspective. And so it was a partnership between the HBCU, a community-based organization, and a number of other community-based organizations. So we really had a large team that came together for this program, and that's really what I want to talk about. So our purpose, kind of grant-funded purpose, is to deliver these interventions to about 600 women in the Atlanta area, direct interventions as in intervention courses, and then we wanted to reach at least 2,500 students with environmental strategies, so kind of social media strategies, campus events, Facebook page, website, Instagram, all these other ways of kind of getting people this information. So that's why it's a multimodal approach. So the main thing we had is a really amazing coalition. And so we had the Holistic Stress Control Institute, we had Spelman College, we brought on a social marketing organization, woman-owned social marketing organization called Banyan Communications. We also worked with a lot of health partners who did a lot of our HIV testing and hepatitis C testing and comprehensive STI testing. So we had a lot of people at the table. That's really wonderful, and it's also very complicated. So the ramp up to the start of the program was pretty intense. You know, if you've ever been through that grant funding cycle, you know, you submit the grant, it's great, and then you get it, and then it's like, oh, okay, now you have to start, like, very, very quickly. So we spent the summer before the grant meeting at different sites. We didn't want it to be an academic-based situation, and so we held a lot of our meetings at the community site. You know, we had lots of meetings there. We had meetings at Spelman. We brought people to both places, and we made sure everybody felt included and was always informed. And so we met about the curriculum. What curriculum were we going to use? What would work about the curriculum? What might be a challenge, because we were going to target primarily students? What might be a challenge for this curriculum? What ways could we adapt it? When we had the hepatitis C curriculum, that was something that was relatively new to both parties, and so we brought in people from the Department of Health to consult with them about what do you teach, what trainings do you use. So we spent a lot of time developing our curriculum. We also spent a lot of time talking about roles and responsibilities, and so we had to kind of create a formal memorandum of understanding in terms of this is what you are going to do and this is what we are going to do, so we're all on the same page. And I failed to mention, we also had a really good evaluation team as well. So with the Holistic Stress Control Institute, they were responsible for providing the curriculum, providing the health educators, and running the actual intervention. They were the people who were going to actually deliver the intervention. And we were responsible for the space. We were responsible for majority of the recruitment and bringing students in. We were responsible for bringing in student research assistants and bringing in program coordinators and partnering with other organizations. And we also had the fiscal responsibility of administering the funds for the grant. And so that took a lot of kind of back and forth in terms of what would work, and we also had to bring in other departments at our institution. So you bring in the financial department, and you know, everyone kind of has a say, but at the end of the day, after a couple of months of intense meeting, it worked. From there, we started our needs assessment, and our evaluation team went out, did a bunch of focus groups with our students to find out, okay, we know what we think we want to do. There's always that piece, but in CBPR, you really need to figure out what you need to do, and that often isn't going to be dictated by what's in your head. So we had these needs assessments, and in those focus groups came information related to what was actually happening with the population that we were working with. So with our students, we found that they were 60% more likely to engage in sexual activity when under the influence of substances. So that highlighted for us alcohol and marijuana was going to be a really big focus. Substance use is more likely in social environments. pretty kind of common among college campuses, but that's something we needed to educate them about as well. There was common access to friends who sell marijuana. There was easy access to alcohol for underage. Most of the students we were working with were underage, but very easy alcohol access. Low awareness of risk, particularly related to hepatitis, so we knew we had to do a lot of work in that area. In the focus groups, there was a reported history of unprotected sex, again related to drinking, caught up in the moment. 33% reported problems with anger or suicidal thoughts in the past. So that put a big focus on mental health. And with the Holistic Stress Control Institute, that's one of their focuses. They're really focused on kind of a holistic, healthy mind, healthy body approach. And so they really went to work in terms of providing these stress management techniques. And then there were all this idea about the stress of school was connected to weekend releases related to drinking. And so we kind of, okay, now we see what this pattern of behaviors. Things that were protective, because everything is not always wrong and everything is not always negative. Protective factors, the students felt pretty confident about them negotiating their needs with partners. There was a high awareness of healthy eating and physical activity, so that piece seemed to be intact. The majority viewed their families as a positive resource, so there was a degree of social support that was available to the population. And the majority reported faith or spirituality as a source of support. So now we know what the needs are and we know what the strengths are, and we can kind of begin to develop something. And so I'm going to skip past this piece because I know time is limited. I do want to focus a little bit more on the emotional health piece. So it was about 16% that reported the thoughts of suicide, and about a third of participants reported problems controlling anger. And this is somewhat unique because we often don't hear about women in anger. Right? We kind of we associate that with men, but these were women who were really open to saying that they had difficulty with anger. So in terms of our intervention that we designed, we did a couple of different previously demonstrated effective interventions, and we put this package together. And so that included this Healthy Love curriculum. It's a CDC certified curriculum that came out of this organization called Sister Love, which is here in Atlanta as well. We used the Alcohol Literacy Challenge. We used In Shape, which is also related to mental health and physical health. And then we used these uniquely designed stress management techniques from the Holistic Stress Control Institute and those designed hepatitis C awareness programs. We had phenomenal health educators. We had really, really phenomenal, really passionate, really committed health educators. And when I tell you they are the key to the effectiveness of the interventions, they really it's kind of making or breaking the intervention. And so they really committed their times. When we first designed it, it was a 3-session, 2-hour per session program. So we were asking students to come to 6 hours of training. They would get $25 for completing the pre and post tests from the evaluators. They would get food and snacks and then kind of these gift bags, right? And so that was fine and good, but that was too long. And so we had to shorten it. And we ended up, our sweet spot was 2 sessions, 2 hours each. And that tended to work pretty well. And so and then this is our some of our marketing materials, but I'm running out of time, so I'm going to just go to what the results ultimately were. And so these are kind of low. So ultimate results, out of 447 participants that we looked at thus far, the pre and post test revealed that people who went through the program experienced their sexual attitudes became less risky. They had less risky sexual attitudes, increased knowledge of local health services, and reduced upsetting and nervous feelings. About 250 students attended those events outside of the intervention. We received about 1,276 website visits, and we've received more since then, but that was at our last check. We had almost 4,500 Facebook page views, and overall, I think we reached around 2,000 people with our indirect messages. And so we found that it was a really effective program. We really diffused ourselves to the campus and the community, and it seemed if we can get this to be something that is disseminated over the long term, we can really begin to impact that alcohol abuse and sexual risk taking. Thank you very much.